Hi, good morning. Can you hear me?
Yes, I can.
Okay,
I was
good.
mute.
Great. I'm trying to figure out the setup. It looks, oh, there we go. It looks a little different on my screen than a normal Zoom call, but I'm just going to turn off my camera for this session. I am so glad you're here early. I was going to ask you for a really quick favor before we transition the slides and just make sure it works okay for me to switch over to you.
Okay.
Looks, I haven't done a webinar in Zoom before, so I was a little unsure how it was going to look, but it looks like it's going to be super easy and the same as a regular Zoom call. So I set up the share screen settings so that anybody can do it at any time.
Okay.
You should be able
So
to.
you should be able to see do you see the web page right now?
Yeah, it's perfect.
Okay.
Yeah.
Okay, good.
So you'll be able to, take it over from me at any time.
Okay.
Oh, go ahead.
Should we have our videos off while other people are speaking?
Yeah, I think that's
Okay.
not a bad idea.
Okay.
I have a question for you though. Hi, Brad. Good morning.
Morning. Can you hear me?
Yes.
Okay, good. Because I only used this for the first time 2 weeks ago, maybe, and it didn't work. So I was kind of having to give visual cues whether or not I agreed or disagreed with something. And so I got it to work yesterday. So good. I'm glad this is working.
Right. I'm gonna ask you guys for a favor. There's our first speaker, her comment, she's incarcerated at Mitchellville, and so I talked with her on the phone yesterday, and I just want to make sure that when I play the recording that it's going to be as loud as possible, or that it is audible to people. So I'm just going to try to play it from one of two different ways, and let me know if you can hear this okay.
A lot has changed within the IDOC system due to the COVID-19 pandemic. Our entire planet is currently dealing with and navigating through together.
How is that for volume?
It sounded okay here. Yeah.
It was okay. Okay, perfect. The other option that I might be able to play it on my computer, but I wasn't sure if this would be something that would be audible. I'll try this.
Thanks for inviting me, Sarah.
Did you hear that when I played that on my computer?
Yeah.
Okay. I'll just play it from my phone then.
Sarah. My name is Nicole.
Okay. Thanks so much for being with us today, Nicole. We're really glad that you could join. Okay. Hi, good morning to everybody else who has just joined. Thanks so much for coming on just a couple minutes early. It looks like folks are getting in pretty well. And feel free to turn your video on or off, whatever you like. I think we may do speaker videos off, and just if you'd like to turn them on while you're speaking, that might work best. But yeah, feel free to do whatever you'd like with your video function. So if you do, I don't know if I know that Ethan is going to share his screen with us when we get to his section. I haven't received slides from anybody, and I know that the speaking window is fairly brief for most of the folks participating. So I know that a lot of folks might not be using slides, but if you are, I have set up the share screen function. So at any time, you'll be able to just press the button share screen. It's that green button that should be right in the bottom of your dashboard of Zoom, and you can go ahead and try that out if there's anything you want to show as you're speaking, or if you have something on your desktop that you might want to share with folks. I think we'll just wait obviously a couple minutes for the rest of our speakers to join, but it looks like we are all set to go for when we get a little bit closer to 11 o'clock, or sorry, to 12 o'clock.
Sarah, this is Daniel from ACLU.
Hi, good morning.
Hi. So I don't have any slides that I'm going to be using, but I will, if you're okay with, share in the chat box a link. So the letter that the ACLU and 25 other organizations sent, I'd like to just share a link to that letter so people can, afterwards read the letter, there's an advocacy webpage about that letter as well. And so I'll be just sharing that in the chat, and I'll let people know that I'll share it when it's my turn to talk.
That's perfect.
Okay.
Thank you. And I have in the tweets that I have all set up in Hootsuite to go out through the session, that will be going out on, I've linked that in the tweet from your presentation as well.
Perfect, perfect. All righty, thank you.
Hi, Michele, good morning.
Morning.
Okay, I'm going to launch a poll that once we start broadcasting, the poll will be open for people as they come in to ask this or to answer this question. And I'll try to put in some polls throughout the webinar as we go along. But I don't have too many scheduled.
Call now and get your free info. Call 1-800-741-0177.
Other mortgages are paid each month, but with a reverse mortgage, you can pay whatever you can.
Hi, Danny. Good morning. I just put you on mute. It's like it sounds like you have the radio on in the background, maybe. So for whenever we get started, we can unmute you. Okay, and because I think folks may begin to trickle in and join from our attendee side, I'm going to begin to share my screen with the slides, and then I'll go ahead and hit broadcast. So I've got everybody on mute right now from the speaker side, and so I'm going to share my screen, broadcast, and then I will start quite promptly at noon with it starting to advance the slides rather than wait a few minutes for a few people to trickle in. But since we're going to be moving fairly quickly through the session today and I have a pretty packed schedule, I will just get right into it at noon. Okay, we are now live on Facebook. Everyone is muted, and for folks who have your video on, feel free to turn your video off until it's your turn to talk, or feel free to leave it on, up to you, either way. I'm going to go back in and share my screen again and present the slides. I just want to make sure that everybody, if somebody doesn't mind entering in the chat, my computer just sent me a funny message about my audio. So let me know if you can still hear me, okay?
Sarah, I can hear you. This is
Perfect.
Dan.
Thank you. I appreciate that. Alrighty. Okay. So here we are in the slides. I'm going to hit broadcast. Good morning or good afternoon, everyone. Welcome to the webinar. We're just beginning to broadcast. We have 3 minutes until the webinar begins, but we're opening up now to let folks trickle in as they join us. Today, as all of you join, you'll notice that your settings are set to mute, both for video and audio. So for participants in the webinar who are not our speakers today, we'll keep your settings on mute throughout the session. Good afternoon. Welcome to today's webinar. For those of you who've joined us in just the past few minutes, you will notice that your settings are on mute for both video and audio for today's session. It's now 12 noon on Central Time, so I'll go ahead and begin our session today that focuses on criminal justice, public safety, and COVID-19 in Iowa. Just a few housekeeping items before we begin today. If you have questions or comments or concerns throughout the session today, please place those into the chat and our staff will respond as you place them. If you have questions that you'd like to ask of our speakers, please save those until the very end of the Q&A segment following the presentations from all of our speakers. And when you enter into the webinar today, you will automatically be set to mute. However, if you're just joining us and have unmuted yourself, please go ahead and mute yourself now, as we're receiving a lot of feedback and background noise. We expect to have quite a few participants joining us today with over 300 individuals registered. So it's extremely important that for a smooth webinar process, everyone selects mute for their audio as we move through the session today. Please note that we are recording today's webinar, but the webinar may not be available via the Iowa Harm Reduction Coalition's website until 7 days from today or sooner. We'll be happy to share this webinar recording with you after that time that it is posted through an announcement on our listserv. And again, please feel free to save all your questions for our speakers until we arrive at the moderated Q&A and the audience Q&A segment. Before we begin, I'll also introduce our host organization, the Iowa Harm Reduction Coalition. IHRC was founded in 2017 and is a nonprofit organization that works to promote the health, well-being, rights, and dignity of people who use drugs, as well as people impacted by drug use across the state of Iowa. We do this through education, grassroots community organizing, advocacy, and policy development at the state and local levels, convening experts to foster critical dialogue regarding solutions for substance use in the community, and by providing direct services to people who use drugs to decrease the risk of both overdose and infectious disease transmission throughout our state. And most importantly, by centering the needs, experiences, and lived expertise of people who have experienced substance use disorders or been affected by them in some way. Today, you can also follow along with us on a number of different social media channels. If you wish, you can join us on Twitter and add to our live conversation thread about the content, or you might join us for the Facebook live stream if you wish to review any of the content from the webinar. And again, just a reminder that if you've taken yourself off of mute when you've joined, you'll want to go ahead and mute your audio right away just to prevent background noise. Today, I'll be your moderator. My name is Sarah Ziegenhorn, and I'm the Executive Director of the Iowa Harm Reduction Coalition. As we move throughout the session today, you'll notice that each speaker will have a slide that looks just like this as they make their remarks and present the content of their individual allotted time. Today's webinar features 11 expert speakers from across the state of Iowa, and they represent a wide variety of perspectives with a wealth of expertise and experience in addressing the need to prevent COVID-19 transmission in Iowa's jails and prisons. After today's webinar, we'll have a number of different exciting resources which we'll be able to share with you, including a written summary of the webinar, which we'll announce when we disseminate as well. You can review the objectives for today's webinar in the bar at right on the screen or at any time throughout the webinar on our website and on our social media channels. Before we begin, I'd like to give a little bit of context. The Public Safety Lab is a national organization which fosters the Jail Data Initiative. In the past several months, the response in the United States to COVID-19 has been dramatic, and we have seen a dramatic decrease as well in the jail population of the general United States, with a steep drop in the number of individuals housed in jails around the United States and a general leveling off throughout the month of April. Those trends are also reflected in Iowa's jail population as well. On this screen, you'll see that the timeline pictured here is slightly longer than on the previous screen, but Iowa has experienced a similar drop in the jail population size for the counties which data is available. Data is not available yet for every county, and so we look forward to working after today's session to augment some of the work that is being done by the Jail Data Initiative. So without further ado, I'd like to get into the speaking session. Today, as we introduce each speaker, I'll take the time to note their title and affiliation individually when it's their time to speak. Around 1 o'clock or shortly thereafter, we'll begin a moderated Q&A with all of the speakers, during which time the speakers will take their mics off of mute and all will be able to participate in conversation. During the audience Q&A, again, we'll ask that you keep your mic on silent and enter your questions into the chat, which you'd like to present. So before we move into discussion from our presenters that are here with us today on the webinar, we'd like to begin with our initial speaker, who's going to be joining us via recorded comments. Nicole Linker is currently incarcerated at the Iowa Correctional Institution for Women in Mitchellville, and she'll share with us her perspective on the experience of COVID-19 prevention measures within her facility. Here's from Nicole.
Thanks for inviting me, Sarah. My name is Nicole. I am currently incarcerated at the Iowa Correctional Institution for Women in Mitchellville, Iowa. I have been here since December 20th and am being incarcerated for parole revocation because I had a gram of 17% CBD, 0% THC marijuana, and this is what I have to say. A lot has changed within the IDOC system due to the COVID-19 pandemic our entire planet is currently dealing with and navigating through together. A lot has changed for every human being currently alive in this world in these uncertain times. Many new procedures and precautionary measures have been put into place and action by the IDOC executive team and are enforced by the staff members of each facility and every day in order to keep the populations of incarcerated individuals in Iowa's prison system safe. Each II has been given 3 washable masks and are expected to properly wear a mask at any time they are out of their rooms and within 6 feet of any other person. The same applies to all staff members. Everyone is consistently reminded to use social distancing. For instance, a maximum of 50 IIs are allowed into the dining hall at a time. The library and salon are closed for business for the time being, and we now must sign up for specific times to use the gym a day in advance. We currently have no in-person visits. However, the IDOC quickly made it possible for us to have video visits with our loved ones over the internet. Also, we each receive 4 free emails and 1 free 5-minute phone call weekly. There are presently no new intakes being allowed into our prisons due to the outbreaks at various county jails along with IMCC. However, when new intakes were still coming in, they were all quarantined in a separate building for 2 weeks so medical staff could be sure new IIs were COVID-free before mixing in with the rest of the population here at ICIW. In addition to new intakes being quarantined, any II displaying signs or symptoms of COVID-19 are quarantined and given rapid COVID-19 testing, which must have a negative result in order for them to return to general population. Staff members must have their temperatures taken, hands sanitized, and masks on before entering the facility for their shift. Counselors now rotate with each other, working on site and from home every other week to further limit our potential exposure to the virus. Although counselors are working in rotation now, mandated classes that many of us are required to complete in order to be eligible for parole are still in session and facilitated by site counselors, whom are all working very hard to keep everything running smoothly for all of us. Changes in daily routines are hard for anyone to get accustomed to, but I know for me personally that I am aware these changes have been made in order to protect all of us and keep us as safe and healthy as possible. None of these new rules and procedures were implemented for the purpose of causing us any discomfort or inconvenience. I have to give a couple of specific shout-outs. One is to the dietary department, who has given us extra snacks, even ice cream every Tuesday at lunch, and works very hard for us every day. You guys go above and beyond and are genuinely appreciated. The second is to our warden here at ICIW, Cheryl Dong. Even under all the stress of running this prison in these trying times, she has done everything imaginable to keep us healthy, comfortable, and informed. Thank you.
Thank you so much, Nicole. Many people have been talking about how crowded Iowa's prisons are, with a population size that exceeds the size that the prisons were built for. Mitchellville is not one of those facilities and is currently under capacity. Was there in the past couple months a release of a number of people living in the prison, and how noticeable has that release of inmates been?
It's been quite noticeable. People are getting out early, like they're getting called into their counselors randomly for immediate discharge if they're like discharging within the next 6 months, their whole sentence. People are being reclassified to take the mandated classes in the community if their district offers that class in the community and their parole officer approves of it. So things are moving really fast now, and it's definitely good. You know, they're definitely trying very hard to get the nonviolent offenders with no mandatories and stuff out of here.
You are someone who would fall into that category as a person who's a nonviolent offender with a non-mandatory sentence, and the charge that you were incarcerated on, the possession of 17% CBD oil products. There are a number of reasons why people might think that you would be a perfect person to be released, especially since your earliest date that you're eligible for parole is in June. What are right now the barriers to you being one of the individuals that is released, and why do you think that the DOC has not moved more quickly to release you within that first round of individuals?
I'm not really sure. I mean, I've talked to my counselor about it, and I don't know if they just don't know, like, how this is all working and stuff, but I really haven't got any answers about that. And I had my mom ask my PO about taking the active class in the community, and she just let my mom know that everyone's getting, but people are getting released very rapidly now because of the pandemic, and we might not know ahead of time about, like, me when I'm getting out and stuff, and so I'm just waiting on home placement. My home placement has been in for several weeks, and I'm just waiting for my counselor to call my aunt to do the interview and then forward it to my PO, and then the ball will be rolling much faster than for me.
It sounds like with the rapidity around the people being released and sort of the sudden notification to release people from the facility, that could cause some level of anxiety, especially thinking about the number of requirements that are placed on parolees once they enter the community, specifically thinking about the requirement that you must find employment. Given the current state of the economy and the number of people who are unemployed, and thinking about the challenges that people with felonies on their record have when it comes to getting employed anyways, are you concerned about opportunities for employment upon release?
Yeah, I've been very concerned about that because, I mean, it is a requirement of parole. I'm sure parole officers might be a little more patient because of what's going on with their parolees, but I've been thinking about it. I've been asking my mom to maybe look at some places, Google and see if there's any employers that work remotely and hire felons and stuff, so I can have an idea at least of where to try to get a job at, apply at and stuff. But yeah, it is stressful because money, unfortunately, is kind of required in our world to exist. So I need to be able to have a job, and I want to be on my own 2 feet. I don't want to really rely on people. So yeah, it's been stressing me out pretty well.
Is there anything else that you are worried about when it comes to getting released, especially into this current climate and being released suddenly? Are there other types of support that you can think of that will be important to provide with people in the community?
Well, I'm supposed to call UCS and see how they're doing the MAP program now. I don't know, because obviously this wasn't happening when I was out and on Suboxone. I got arrested in September, so it was just normal then. But the psychiatrist here wants me to call with the psychologist and see how they're doing that, so that I can start Suboxone right away and everything, and whatever, maintenance and stuff. that's the main worry for me, is I just don't want to like be bored. Like boredom is really bad for me. I don't want to be bored and then try to go do drugs. So I just.
And that's the end of Nicole's conversation, which I recorded with her yesterday. I'm delighted that we're able to feature the perspective of an individual who's currently in one of Iowa's correctional facilities. And now I'd like to go ahead and welcome our first speaker, the 10 individuals who are joining us on the webinar today. Welcome to all of you, and thank you so much for joining us. Let's go ahead and begin with Michele Hines. Michele is the Executive Director of Inside Out Reentry Community, which is based in Iowa City. Michele works with a number of individuals who are currently incarcerated or who have been incarcerated recently. Michele, what can you tell us about the experiences of these individuals within the community right now?
Thank you, Sarah. So as you mentioned, we work with folks while they're currently incarcerated to help them prepare for their release, as well as help support them as they are reentering into the community. And in talking with our incarcerated members, what we've really been hearing, like as some of what Nicole has said, is they know that there's a lot of anxiety. There's a lot of anxiety around, sort of the spread of coronavirus. The Iowa Department of Corrections has taken some great precautionary measures, as Nicole mentioned. Individuals are given masks, gatherings have been reduced, but these measures, even though very important and need to happen, also do have impacts on individuals. When units are on lockdown, there can be some serious negative impacts on mental health when that happens. And so a lot of the individuals that we're hearing from are just struggling right now in these situations. Visitations are suspended, but the Iowa Department of Corrections has started offering video chats, so people are able to still connect with family and friends, but it is different than being in person. And we've also heard from a few individuals who've lost family members as a result of coronavirus, and how difficult it is right now to be separated from your family, and sort of the feeling of powerlessness is something that has been shared with us from some of those that we work with. I would say the biggest piece of anxiety that we've been hearing, though, is over release. So the Iowa Department of Corrections, as you mentioned, has announced that they're expediting the release of 482 individuals. And we have seen individuals we're working with be released early. So we are seeing this happening. But a lot of the individuals that we're working with that are still inside are really anxious about getting released and want to be getting out as soon as possible. They're reaching out to us with a lot of questions and also a lot of misinformation. So there's definitely some misinformation around the releases that's sort of spreading within the facilities. And so, when folks reach out to us with stuff that doesn't sound right, we're trying to, correct it and give them the information that we know is accurate. But that misinformation does build even more anxiety. We're getting lots of questions around employment, who's hiring, what does it look like? People are struggling to have a good picture of what it looks like before they get out. And then that adjustment as they're getting out is really challenging. People that are used to being able to go and start employment are having a really hard time finding anything. And if they do, not really enough to help support themselves right now. And expediting release and focusing on reducing the spread is really, really important, and it's a really big step. But as a reentry provider, I also want to make sure that people are prepared. Life is going to be like on the outside, and making sure that people have accurate information about their releases and about what it looks like out here, because it is a very different environment. It's already really challenging to reenter the community after incarceration. So the more information that people have right now, the easier that transition will be. And one thing we've been seeing is that it would be beneficial if people had some more preparation on the reliance of technology right now. People are coming out and they're never heard of telehealth appointments. They're not familiar with a lot of this stuff. So having some kind of a heads up or information about some of the major differences that our society right now is using to adjust to make sure that folks on the inside have that before they get out, I think is really important. And, we believe that, in addition to having that information about protecting themselves, really knowing what to expect when they are released is really important, especially because we're seeing some of these expedited releases, as Nicole mentioned, and knowing what to expect when you get out will help definitely with that transition.
Thank you so much, Michele. We're so grateful to have you here. Our next speaker is Danny Hellman. Danny is the leader of AFSCME, and he's here to speak with us about the individuals who are represented by his union, including those who are employed by the state and work in Iowa's prisons and community-based corrections facilities. Danny, welcome. Thank you so much for being here. We know your time is limited today and that you'll have to drop out of the conversation after your presentation is finished, but please, what can you tell us about the working conditions in Iowa's prisons and in the community?
Yeah, thanks, Sarah. I hope I'm on. I think I am.
You are.
Okay. I hate this technology stuff. I'm too old for this. The bottom line is working conditions inside of Iowa's correctional facilities for staff and for inmates right now are terrible. The Department of Corrections is not supplying the proper personal protective equipment for staff. These cloth masks that they're handing out, they're trying to pass them off as personal protective equipment. They're not. They are not effective in stopping an individual from being infected by this COVID-19 virus. Right now, we have had a major outbreak at the Iowa Medical and Classification Center. And through some discussions with the director that I had the day that was announced, the next day, she basically shut down the Department of Corrections. No more intakes, where the department's not accepting any more inmates, either at at IMCC or at Mitchellville, because they have to find out what's going on inside our systems. I was just informed this morning of an inmate testing positive at the Corenda Correctional Facility. And I've reached out to the director to find out what we're going to do, what the protocol will be, and how we will handle that particular situation. The biggest fear our staff have, folks I represent, and that I have, is that Iowa will become Ohio. And in Ohio, they have had major outbreaks of COVID-19 inside their correctional facility. At one prison, for example, over 1,800 inmates have tested positive for COVID-19. I don't want that to happen here. I don't want that to happen here for the staff. I don't want that to happen here for the inmates. My main concern is to make sure that the staff that come to work every morning can go home at night and not infect their families. So we believe every employee should be provided an N95 mask, a real personal protective equipment item. They should be provided goggles and a shield. They should be provided gloves. And those inmates that become infected should be quarantined. At the point in time we start taking new inmates into the system, then those folks will have to be quarantined for 14 days. It's really important that we try to stop this virus from getting inside our prisons. And equally as important is it's important to stop this virus from getting into our residential treatment facilities. That's where I started my career with the state of Iowa back in 1984. Right now, we have 4 facilities in the state of Iowa that are not taking admissions. Sioux City, Fort Dodge, Marshalltown, and Waterloo. Obviously, if you look at what's going on in those 4 cities, At least 3 of the 4 are involved with major outbreaks in packing houses in those cities. And a lot of the folks inside residential facilities have to go get jobs. A place where you can go get a job, even back when I was with the department, was at a packing house. They're not taking any new admissions, and they're trying to test all inmates and staff to find out what the heck is going on inside that facility. How bad is this virus? That's the concern. I am trying very hard to work with the director of Department of Corrections in trying to ensure that not only are staff safe, but that our inmates are also safe. My belief is if the staff are not safe and the staff end up getting sick, then who in the heck is going to be there to take care of the inmates or the folks inside our residential facilities or any other facility that the state of Iowa may have? Because this is also at the Iowa Veterans Home. This has also been into some of our resident mental health facilities and our resource centers. So this is a big deal. This virus is terrible. I could have the virus and not know it. I could have the virus and be walking around. Fortunately, I won't affect anybody because I never go anywhere. Get my car in the morning, drive to the office, get my car at night and drive home. That's it. Best thing for everybody to do is stay at home. I believe that the actions that this governor took and what's going to happen starting tomorrow is not going to help us flatten the curve of this virus. Matter of fact, I believe that May 1 may become known as when the second wave of COVID-19 started in the state of Iowa. So I don't know if you have anything else, Sarah. We're not providing the proper personal protective equipment for staff or the personal protective equipment for inmates. We need to do that. We need to do that to protect people's lives. People die of this disease. And, it wasn't too many weeks ago where we didn't have very many cases and or deaths in Iowa. And now we have over 6,000 cases and over 140 deaths. We're going the wrong way in this state. We need to turn it around. And
thank you so much, Danny. We really appreciate you being here. These comments are extremely important, and we're very glad to be able to include the perspective of people who are employed in correctional facilities and recognize the importance not just of thinking about inmate health, but recognizing the way in which correctional facilities engage directly with the environment around them. So thank you so much. Our next presenter today will help us to switch gears a little bit. So far, we've been talking about prisons and operating at the state level. Now we'll move a little bit more into the community and the county level. And it's my pleasure to welcome my friend, Dr. Pramod Dwivedi, who is the director of Lynn County Public Health Department. Pramod, thank you so much for joining us. Can you tell us a little bit about what is going on in Lynn County?
Yes. Can you hear me?
Yes, it's perfect.
Okay, great. Good. So, my area of work is public health practice, and my training is in preventive medicine, focusing on epidemiology. And a lot of times, in public health, we look at person, place, and time. So I just wanted to give you some numbers first, and then we'll talk about what's going on here in Lynn County. So as of this morning, according to the Centers for Disease Control and Prevention, there were more than 1 million cases of coronavirus, which is the name of the disease is COVID-19. And there are more than 57,000 people have sadly perished. In our state, there were 6,843 cases. Out of that, 2,428 are recovering, and there are 148 deaths, sadly. In Linn County, there are 660 total number of cases. 391 have recovered. 226 are active cases, and sadly, we have lost 43 of our neighbors here in Linn County. One of the things here that, since the very beginning, we have been very proactive in our community. We've been talking to our area hospitals, our local partners, as well as our state and federal partners. I was actually one of the 30 people who were invited for a White House briefing in early March on this issue. We have also created our unified command by which we are looking at the situation every day. We are very, very busy with contact tracing, trying to follow people. We are, as I said, working with our hospitals. And the caseload is increasing each day, which is creating a challenge for us to continue to sustain our work at the moment. Fortunately, we do not have any inmates in our county jail system. There were a few staff who were tested positive for the virus. I grew up in India, and I know how crowding, congested living spaces can create havoc. You know about tuberculosis, and crowding has led a lot of outbreaks in different places. And one of the things that I can tell you that because of the crowding and here in America, there are more people behind bars than any other nation on earth. And our correction facilities are very, very crowded and unsanitary. Folks often have history of poor health care. Many suffer from respiratory problems and heart conditions. So, a lot of recommendations that we are making through our federal and state partners, like avoiding crowds, frequent hand washing, disinfecting clothing, they're very, very difficult, if not impossible, to carry out inside a correction facility. I spoke to some of my local partners, and they are telling me that they have been working with us, obviously. They're telling us that all arrestees are screened for COVID-19 before acceptance. Linn County has designated cell blocks away from the general population where inmates with COVID-19 symptoms can be isolated. They are not accepting defendants arrested merely for no-show charges. Professional visitors such as attorneys, investigators, etc. have been restricted from entering the correctional facilities. Volunteers are not allowed to enter the facility. Inmate visitation are temporarily canceling beginning Sunday. They have already canceled it in March. Each cell block has cleaning disinfectant solution along with paper towels that they can use at any time, and they are encouraged to use it frequently. Each inmate has been given information describing the practice of good hygiene habits that include the guidance from the Centers for Disease Control and Prevention. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth with your upper arm or tissue when coughing or sneezing, and dispose of any tissues. Clean and disinfect frequently touched objects and surfaces. Each inmate has been given a copy of the CDC paper titled "What You Need to Know About Coronavirus Disease." Inmates have been moved to cell blocks, allowing for appropriate social distancing. Inmates that are in individual cells are allowed to keep their cell doors open so they can remain in their cells, rather than being required to be in the day areas to practice appropriate social distancing. Temperatures are taken of all persons, which is staff, inmates, other law enforcement officers, contractors, etc., before they enter the jail. Laundry, bedding exchange is completed more frequently.
Yeah, this is Dan Hellman.
And Sarah, one important thing is that the population of our jail has dropped from 328 to 228. So about 100 drop in the jail population. Jail is utilizing video court more for state and federal prisoners, so they are not leaving the facility and coming in contact with others outside the facility. And as I said, there are no inmates have tested positive for the COVID-19 virus. So Sarah, this is really a tribute to the work that has been going on proactively by the Sheriff's Department here in town, and all the collaborative work that we are doing. It's a pandemic, and we all need to work together. And these are our folks. We need to have compassion and empathy. This is a vulnerable population, so we need to, care for them extra. And as much as we can. Educate our staff and inmates. I think that's a good strategy. So with that, I'll stop.
Wonderful. Thank you so much, Pramod. We're very pleased that you're able to be here today, and thank you for sharing these important comments and your perspective on what's going on both in Linn County, but also the role that jails and prisons play in the spread of COVID-19 within a community setting from an epidemiological perspective. Next, it's my sincere pleasure to welcome Sergeant Brad Kunkel from the Johnson County Sheriff's Office. He's been leading the response to COVID-19 from within the Sheriff's Department here in Johnson County. For those from outside of Iowa who've joined for our webinar today, Johnson County is one of Iowa's larger counties, and it falls directly to the south of Linn County, where Pramod joins us from. While Linn County is home to Cedar Rapids, Iowa, Johnson County is home to Iowa City. Brad, thank you very much for being here. Welcome. What can you tell us about the steps that have been taken in the Johnson County Jail?
Yeah, so first of all, thanks for having me. I'll just kind of go through briefly what we've done and kind of save more of the content maybe for questions later. But so we started taking some pretty swift action during really that first week of March, and sanitation in the jail was a really big focus. But some of the other big significant changes we ran into were really the help we got from like the county attorney's office and the court system in helping to reduce that jail population and how court hearings and proceedings were handled. We had discussion that was in the works about how to prevent outbreaks in the jail. We started making bleach water and antiviral wipes cleaned it for places like the booking area. But now keep in mind, this is all when it was publicized that 12 of the Johnson County cases were all from the same cruise. So Johnson County suddenly was this kind of hotspot for Iowa and COVID positive cases. By about March 10th, we'd implemented a screening process to screen new inmates for COVID signs. We made N95s available for those who met criteria to be isolated, and we really stressed PPE and hand washing in the jail. And then the next 2 weeks were probably had the most moving parts, just as we made changes to prevent the virus from entering the jail and keep the staff safe. It was an interesting time because data and information from IDPH might change pretty rapidly too. So we were really adjusting rapidly. But proactive cleaning and sanitization in the jail became a way of life, really. PPE was stressed, but we also had concerns about burn rate for our PPE. One example we made to adjust for that would be jail staff was given like heavy duty rubber gloves to use for things like changing garbage. So these gloves could be sanitized and reused versus using disposable gloves for everything. But we also eliminated services in the jail like library and AA. Our on-site video visitation was ended and attorney visits started moving to over the phone. But really the biggest change we made was just to the jail population itself. And for some historical background, when the jail was originally built about almost 40 years ago, the original capacity was 46. It was double bunked a few years later. So our capacity is 92. However, our normal kind of safe operating average day-to-day population is right around 60 in-house. On March 1st, we were at 63 in-house, and this number fluctuated normally really for the next few days, but really the big reduction you started to see was around March 10th. We went from 72 to 64 inmates in-house. On the 13th of March, we went down to 55, and then it was a pretty precipitous drop all the way through the end of March when we ended the month at 28 in-house. We've trended back up since about March 11th, and today we're at 36 inmates in the custody in Johnson County Jail. We're also still housing 8 out of county. And just to give you an idea who's in jail right now, of those 36, only 2 are still serving sentences. One of those is a pretrial inmate who went from being pretrial to sentenced while he was in jail. He's finishing his sentence, and the other one is a 30-day sentence on some theft charges. But again, the work to reduce the population was this collaborative effort with the county attorney's office, the court system, and the Department of Corrections. I mean, it was really through their help and their efforts that we were able to reduce the jail population. And that was working so they could do things like resolve cases, change release conditions, and those kind of things, just so we could do what we could to have social distancing be enacted in the jail, given that it's a small jail that's functioning in 2020 conditions. Now we're holding steady with everything from PPE to our sanitizing efforts and everything else. It's kind of our way of life now. Currently, all personnel going into the jail area, this includes not only staff, but say maintenance personnel, are having their temperatures taken, and all employees even coming into the building now are taking our temperatures at the start of our shift. So it was, we've had to make a lot of decisions kind of quickly and rapidly over the last, almost 2 months now. But it's been a very interesting time to be in public safety, to say the least. So yeah, thank you for having me. And with that, I will stop and hold for questions later.
Thank you so much. That's perfect, and a great overview of the steps you've taken. And we really want to recognize how unprecedented these changes that have been made are, but also how successful they've been in preventing the spread of infection in our county facilities. So thank you very much for your work. And next, I'd like to introduce the jail administrator from Black Hawk County. For those joining us from outside of Iowa, again, Black Hawk County is north of Johnson County and home to another one of Iowa's larger metro areas, Cedar Falls, Waterloo Captain Neff, thanks very, very much for being here with us today. Can you tell us a little bit about what you're seeing in Black Hawk County? Captain Neff? Are you still with us? You might be on mute. Okay, it looks like we may be having some connectivity problems with Captain Neff, but we can come back and we'll move forward and then come back to you once you're able to join us with audio that is working a little bit better. Okay, so I'd like to move on and hear from Adam Sullivan. Adam is a journalist at the Cedar Rapids Gazette and writes regular editorial content and columns within the Gazette. Adam's been covering the spread of COVID-19 in Iowa, the response from the governor's office, and the steps that have been taken to prevent outbreaks within correctional facilities. Adam, welcome. Thank you so much for joining us. Can you tell us a little bit about what you've learned about the variability between Iowa's counties and the disparities that you've seen around the state in the steps that have been taken to prevent COVID's outbreak? Adam, are you still with us as well?
Hey Sarah, this is Nate. Did mine get fixed?
Oh, great. Let's go back to you. Here, I'm so sorry. I'm glad that we can hear you.
If I apologize, I had the wrong microphone selected. So.
No worries. I'm so glad that the audio is able to work. Yeah, can you tell us a little bit about the response in Black Hawk County?
Yeah, again, going back about March 12th is when we really kind of started taking our precautions here. Up till that time, we'd only had a couple cases in Black Hawk County, and they were actually all within one family, and we kind of knew exactly where they were from. So we still felt fairly safe at that time, but on March 12th, we went ahead and we did a deep cleaning at the jail, just to kind of get a baseline for where we were at. We disinfected all the areas, both the public and the jail side of things. We actually did a shakedown of the entire jail, which normally for jail purposes, we do that more for a security thing, checking for contraband, that kind of thing. We went ahead and did it this time just more from a sanitary standpoint to make sure that anything that didn't need to be in the jail was out, if there was any old food, and as well as contraband and stuff, obviously. But we just kind of wanted a baseline on that. We ordered extra gloves, extra toilet paper, any extra cleaning supplies, any of that stuff. We tried to get kind of ahead of the curve on that. And especially at that time, that's when the big toilet paper shortage was underway. So we wanted to make sure we didn't fall prey to that. And then at that time, we went ahead and made hand sanitizer available for all, which is something typically the inmates don't have access to, just the staff. But we went ahead and set that out so everyone had that available. And at that time, we were just kind of going to write it out and see where we were. And like I said, on March 16th then, we kind of started to set things up a little bit, kind of in accordance with the state, and we were following along with what the governor was doing as well. On March 16th, we canceled all of our inmate programs, so anything that would have been face-to-face with the inmates, as far as AA, any of the mentorship programs, church, Bible study, that kind of stuff that we normally do. We were still allowing visitation at that time because our visitors that come in to visit the inmates don't have access or direct access to the inmates. We were still going with that. We did start screening our inmates at that time. Any arrestees coming into the building were asked screening questions, such as, if they had contact with anyone, if they'd been out of state, that type of thing. Anyone that answered yes to that, and we also took their temperatures. Anyone with a temperature was placed in a 14-day quarantine at that time. And then by the next day, things were starting to ramp up throughout the state. So at that time, we did cancel all inmate visits. And again, even though they're non-contact visits, we hold up to 272 inmates in our jail. So the amount of visitors that come in there can be upwards of 30 or 40 people in our lobby waiting for a visit. So obviously that was too many people to have in one place. So we just canceled all of our visitation down. The front doors of the building was locked, even though our girls at the front desk were still working for anything civil related. So Mass Control was able to control that door. They would let one person at a time in to go to the front counter to handle any, whether it be weapons, permits, or sex offender registry, anything else that goes on at the front counter. So that way we're just allowing one person in the front office at a time to deal with that. Within a few days after that, our medical staff began checking temperatures of all the staff, both at the beginning and end of shift. Beginning, obviously, to make sure we weren't bringing it in. But by checking at the end too, then we felt we could, if someone did spike a fever during that, we at least knew who exactly they had contact with and what we could do to try and minimize their contact going forward once they left the building. For about the next month, we really kind of rode status quo on that. For where we didn't really implement anything else, but we didn't take anything else away. And then here on April 21st, we decided it was time to start quarantining all inmates that come in, regardless of how they answered the questions coming in. So we cleaned out one entire living unit, pod that we call them, and everyone that came in, regardless of their status, was placed on a 14-day quarantine in that. So they're not out with any other inmates. They're not out with any other staff members, anything. 1 hour a day, they come out of their cell to use the shower, get some exercise, do that. Otherwise, they're in their cell. And then once that 14 days is up, then they're all, which this, like I said, just started on the 21st, I believe. So those people are just coming up on the end of their 2 weeks, the ones that come in. So they'll be phased into the general population pods here shortly then. And just yesterday, we were able to get enough masks that every inmate in the jail has now been given 2 cloth masks that are machine washable. So that way they can always have one. They can send the other down with their laundry, their uniforms and that kind of stuff. Throughout the last 6 weeks, we've started using either phone or that kind of stuff a lot more for court hearings, for defense attorneys who want to talk to their clients, that kind of stuff. Things that we typically don't really allow the phone to be used for, but obviously we're making exceptions to make that work for us. Okay, I mentioned our population earlier. We hold up to 272. Last year, our average daily population was 266 for the year, and as of today, we're down right around 120. So our population has dropped dramatically, and that's not so much on us. Obviously, we're more than happy to get the social distancing and get less people in here. But we have to thank really the county attorney, the courts, the public defender's office, even the Department of Corrections. A lot of those people have been taken out on pretrial. The judges have been given time servers, either extended time to get their time done, or just giving them credit for time served if they were close. Most of our nonviolent offenders have been released. They'll have to come back for court, that kind of stuff later on down the road. But anybody that's really on a nonviolent offense has been out of the facility. Unfortunately, it means that the 120 inmates that we do have are kind of our worst of the worst, and we've seen just as many, if not more, fights and that kind of stuff. So there's still issues to be dealt with in the jail, but those are at least easier to deal with when there's less than half of the normal inmates that we have. Other things we've been able to do is, obviously, the arresting officers aren't out working warrants. They're not trying to arrest people. They're just not as busy, and even if they wanted to be that busy, there's frankly not that many people out on the streets to be arrested. The ones that come to jail, we've been given a greater leeway and given promise to appears. And even when they do stay for court-ordered initial appearances, the judges have been great about either lowering bonds, giving bonds that would be normally lower than they would be, or just flat out promise to appear people. So that's all helped. Like I said, we went from 266 last year down to under 120 right now. By not having visits, our telephone provider company, Inc, is also kind of ponied up, and they've given every inmate 2 free phone calls per week. It's only a 5-minute call, but in lieu of not having visitation, at least that's 10 minutes of communication with the outside world that if they don't have any money to make phone calls, they're allowed to do. Fortunately, we've been very lucky on our staff and the inmates. We have not had a single one of our own employees or a single inmate test positive for COVID yet. The precautions we've been taking have been working. Unfortunately, just in the last 2 days, we've had one of our nurses and one of our kitchen staff have each tested positive. I guess to clarify, when I said none of our employees, they're both subcontracted. So while they work in the building, they're not technically our staff, but obviously we still follow the same precautions with them. The kitchen worker, her roommate works at Tyson's and had tested positive. more than likely obtaining it through there. And nurse, we think we know where she got it as well, so we're confident that neither one came from in-house. And the nurse now hadn't even been here for almost 2 weeks, so we're pretty comfortable that she didn't have access, and our kitchen staff don't have any interaction with the inmates or anything. So we're still confident that we're safe, knock on wood, but we're doing all we can to keep it out. As far as moving forward, right now we don't really plan on changing anything. Like I said, all the staff, all the inmates have personal protective equipment. We're screening everyone the best we can, both staff and inmates again, and just doing what we can to keep everybody safe here.
That's great. Thank you so much. It's wonderful to hear from you, and we're glad to hear about the major changes that you've been able to make and the success that you've had. So thank you so much for the work that you're doing for our communities. Adam, are you with us at this point?
Yep, I am. Can you hear me?
Yes. Thanks
Great.
so much for being here.
Yeah, thank you. So as others have mentioned, Iowa has made some really good progress with reducing the incarcerated population, but the truth is that we really don't know how much yet. So from a journalist perspective, I want to talk really briefly about transparency in our jails and prisons. Obviously, at some point, transparency is prescribed by law. So arrests and jail rosters are public records that anyone can request and get, but not all of that data is available online in every county. So the jail data initiative that Sarah cited earlier, only about a quarter of Iowa's counties have data available there. I believe that the ones that are missing from there just don't have data on their websites that could be scraped. So not every county posts their jail roster every day like the bigger counties do. So I just want to take one example that I've written about recently, which is Muscatine County. It was in the news the past couple weeks for some inappropriate statements that the jail administrator there had made. What's interesting about Muscatine is that it's a medium-sized county, but it's kind of positioned itself as a regional incarceration center. So they take inmates from other counties. They also take inmates from the federal government, but it's also one of the counties that doesn't have a jail roster on its website. So it's the 14th largest county in Iowa. It has the 7th largest jail in Iowa, but we don't know who's in there on a daily basis just by going to the website. And even when we do have the numbers, like we do for most of the bigger counties in Iowa, we don't always have a sense of what's really going on inside the jails because there's not a lot of context to that data. So the Jail Data Initiative wrote, we know little about what county jail practices are, including which counties are systematically jailing defendants pre-trial and or post-fine, and about the consequences of these practices. So the basic jail numbers of the number of incarcerated people is really only a glimpse of what's happening. So the other important piece of this is the journalistic coverage, because that gives us more details and context about the local decision-making. But here we're in another problem again, because Iowa's newspaper industry is shrinking. Right now, there's only 33 daily newspapers across the state, but there's almost 400 law enforcement agencies in Iowa. So you can do the math pretty easily, and we can safely assume that most police chiefs and sheriffs don't have a journalist checking in with them on a regular basis, perhaps maybe never, or only when there's a big crime going on. There simply aren't the reporting resources in the vast majority of counties in Iowa to cover all those things. So I work at the Gazette, which is the second largest newspaper in Iowa. It's a regional newspaper. Roughly, we cover the Iowa City, Cedar Rapids, and Waterloo media markets, the TV media markets, which include 21 counties. But no regional newspaper in the world has enough resources to have 21 county courthouse reporters, and so a lot of those stories go uncovered. So I think this is also an issue that cuts across a lot of the work we do in harm reduction and criminal justice, that a lot of our efforts are understandably focused at our big cities because those are incarceration centers, and that's where our newspapers and our nonprofits and our advocacy organizations are. But it's also important that we reach out to build connections in rural areas. I don't think newspapers in small towns are going to come back, but organizations like the Harm Reduction Coalition, I know, think that this is important and are working to build connections in those communities so we can have a better sense of what's going on outside of our big cities. So with that, I just want to thank Sarah for having me today, and thank you to all the other panelists for being here as well.
Thanks so much, Adam. I really appreciate your comments, and we're really glad to be able to include your perspective. Now I'd like to welcome Dr. Baresh. We are a little bit behind time today, but because of the expertise of all of our speakers, we'll shorten our discussion time and make sure that everyone's able to speak for their fully allotted time. Chris, thanks so much for being able to join us today. And thank you very much for the work that you're doing in the emergency department at University of Iowa Hospitals and Clinics. Can you tell us a little bit about what you're seeing on the front lines and how this relates to what's happening in the prisons and jails around the state?
Sure, thanks for inviting me, and really pleasure to hear from all the other panelists. Yeah, so I work in the emergency department at the University of Iowa, and we're a regional referral center, really a referral center for the state for some conditions. And we've been seeing increasing numbers of people coming in with COVID-19. The biggest problem that we're seeing right now is is a lack of number of tests. And so for every person that I test for COVID-19, there's 2 or 3 that I want to test that I'm almost positive have it, but that don't meet testing criteria because they don't have the right kind of specific constellation of symptoms. And so people that just come in with sort of belly pain and diarrhea that had been exposed to someone with COVID-19, they never get tested or reported. I think kind of with respect to what we're talking about today with incarcerated populations, I think it's really important to keep in mind that the health of our prison population really has a direct impact on the health of the rest of our population. We've been talking just recently about the numbers of people in jails that are getting out. Of all the people that are incarcerated right now, 95% of them are going to be released at some point. And so we've seen this in the past with things like tuberculosis or hepatitis C that spread really, really easily within an enclosed population. And then folks get out of that situation, they're released from their incarceration, and that helps spread that disease within the community. There was a huge TB epidemic in New York in the late 80s, early 90s that was in large part fueled by people transitioning back and forth between being incarcerated and the community and spreading multi-drug resistant tuberculosis. And so I have a lot of concerns that that sometimes the general public overlooks the health of incarcerated populations and overlooks the risks that poses to all of us. I mean, really, we have to do a good job of taking care of everybody. And I want to congratulate our law enforcement officers that we've had on here so far today. They really have done a great job. We work really closely with the Johnson County Jail, and they're really well set up and very responsive to people that are coming in that are potentially infected. And so that's been really good. But I think this problem is not going away anytime soon, and is still getting worse. I think right now it appears that we're going to have the healthcare resources to take care of everybody, but there's still a lot of bad things that could happen. And I think there's so many different models out there that combine so many different sources of information that it's hard to predict precisely what is going to happen. So I think that the messages that we've been hearing all day long about social distancing, really paying attention to hand hygiene, keeping your face covered as much as possible, are all really important messages to take away from this. So, and I'll be around for questions later if people have them. So thank you.
Thank you so much, Chris. We appreciate the work that you're doing, and thanks for being here. Brian, can you tell us a little bit about the work that's being done at a national level by an organization that you work with, LEAP, the Law Enforcement Action Partnership, to encourage further action to be taken both at the state and local levels to reduce COVID transmission in Iowa's correctional facilities?
Sure. Let me tell you a bit about LEAP very briefly. LEAP is the Law Enforcement Action Partnership, and what it is a group of mostly former police officers, prosecutors, judges, and some current people in those, who currently hold those positions, who speak out on criminal policy issues, drug policy issues, criminal justice reforms. So this is obviously something we are very concerned with. I am in the Kansas City area. I coincidentally grew up in Waterloo, Iowa, and went to University of Northern Iowa, but I've lived in the Kansas City area for most of my adult life. So LEAP weighs in on policy issues like this, and we wrote a letter to the governor of Iowa and asked her to take some actions, and some of which she did. I can tell you Iowa's doing, and we're talking about the state penitentiaries now, doing better than Kansas is. We've just had a couple of people die in the penitentiary near my home from COVID causes in the last couple of days, and I'm afraid that's going to keep going. Kansas has released nobody from the state penitentiary, although the governor has generally been pretty progressive on issues like this and keeps promising to look at it and work on it, but nothing's getting done. And people are starting to die in the state penitentiary here, one of the state penitentiaries. I see in Iowa, the governor has approved over 100 early releases, and this was in our letter, focusing on common sense ideas to let the medically high risk people out, reduce the general population by releasing people who are only there for technical probation and parole violations, or people whose sentence would be done within 180 days anyway. Obviously, we hope Iowa continues to take action and do more things, but at least it's doing a lot better than the state I'm in, which is Kansas. I enjoyed listening to the gentlemen who were jail administrators. I can tell you that they're doing better than my local jail here. I live in the suburban area of Kansas City, and the jails have reduced their population a little bit, but not much. Our advocacy on this was to advocate people. This is LEAP's advocacy. Advocate officers to give citations when they can, rather than arresting people for, mostly misdemeanor and minor offenses, and to suspend the idea of cash bail and release all but the most dangerous inmates in the county jails. And then once this crisis is over, we hope some of these reforms stick around instead of going back to the way it was before. I know it's a national concern and issue about a cash bail, the idea that whether you sit in jail during the pendency of your case depends on how much money you can scrape up, is just not a fair way of doing things. So those are our areas of advocacy. I don't know if our letter had anything to do with what the governor has done up there, but we're glad something is going on up there, and I will stick around and entertain any questions down the line.
Thanks so much, Brian. We're glad you're able to be here, and I think this perspective is extremely important to highlight in comparing what's happening in Iowa to our neighboring states, and to recognize what's working in our state and the efficacy of all of our leaders in the criminal justice system here. So thank you so much. I'd like to welcome Ethan Rodgers. Ethan is a research associate in the Crime and Justice Policy Research Program at the University of Iowa's Public Policy Center. Ethan is going to share with us a resource that's been developed at the university to track and document what's happening in the Iowa Department of Corrections. Ethan, we're so glad you're able to join us. Can you tell us a little bit about the work that you're doing?
Sure, and thank you, of course, to you and the Iowa Harm Reduction Coalition for organizing this webinar. So at the Public Policy Center, our primary mission is to conduct research and provide information to both policymakers and the public that may be used to improve our community. And so during this current pandemic, we felt one way to achieve that mission was to compile the data, news, and policy relevant decisions regarding COVID-19 in Iowa's correctional population. So with Alex Tukolsky, our senior application developer, and Mark Berg, director of the Crime and Justice Program, we've made this resource available at ppc.uiowa.edu/Iowa Corrections, as shown there on the screen. And I'll get into some of this information. I need to share my screen here. So hopefully you can see my screen and the web page. The Iowa Department of Corrections has been quite transparent regarding their population and COVID-19 numbers. So we did decide to begin the web page with an up-to-date report of these numbers. As you can see, as of today, there are approximately 8,126 persons incarcerated in Iowa prisons, with 19 testing positive for coronavirus. Additional 6 staff, the DOC prison staff, are reporting a positive test. Note that 4 confirmed cases were just reported today. 3 of those are at the Iowa Medical and Classification Center, where the other cases have been, but one, as Danny mentioned at the beginning of the panel, has now just been reported at the Clarinda facility. Now, we did also want to provide additional ways to visualize these data. So oftentimes visualizations can give our policymakers and the public some unique insights. So for example, we do have the location of each Iowa prison on this map of COVID-19 cases and deaths across Iowa counties. So if you tool over a county, you can see the number of confirmed cases and deaths, at least to the last updated date, along with, you can also tool over a prison to see some additional information, including population numbers and confirmed cases. Here, the Clarinda facility, the southern part of the state, is announcing the 1 confirmed case. Now, we do have another visualization that provides the population capacity of each facility. So the population are these blue columns, the black block there represents the capacity. The Iowa Department of Corrections and other agencies are paying close attention to their percent over capacity. We know that overcrowding is one of the reasons that infectious diseases such as COVID-19 spread more easily within prisons. So you can see here, there is considerable variation across these facilities. Anamosa, for instance, is 7% over capacity, while Mitchellville is currently approximately 7% under capacity. Now, we are also developing some trend lines. Here, we have the trend in Iowa's prison population since March 23rd. And if you tool over the specific dates, you can identify specific populations of facilities. We are currently on April 30th, again, total population of 8,000. That's down about 393 persons since March 23rd, decline of about 4.6%. Now, just to give you some context of the current prison population, we're at 8,100. The last time the DOC reported a quarterly population of less than 8,200 was in 2016, so approximately 4 years ago. Now, another useful tool is to think about this trend line in the context of some specific events or policy decisions. So for example, it was April 10th that the DOC reported its first case among correctional staff. At that time, they also reported that they would continue to work towards transitioning as many persons as possible to community supervision. Now note, in the 18 days prior to that announcement, the prison population had declined by about 29 people. So that's about 0.3%. Now, the roughly 20 days after that announcement, there's been a decline of about 364 persons, so about 4%. 4.3% decline. Now, we are also putting together some trend lines for other numbers, including the population and community-based corrections. But given the focus of the current panel, I do want to return to some jail trends. I'm also drawing on the data that's provided by the Jail Data Initiative from the Public Safety Lab that Sarah noted at the beginning of the panel. You've already seen this figure here. This top line is Polk County. You see their population throughout January, February, and early March was over 800, and then there's been this precipitous decline. One important note to this is that these declines do seem to be consistent across larger jails, as well as some of the smaller jails here in Iowa. So these are the jails with a current population of less than 100, again, in these data. And you can see Hardin County, for example, in early March having a population around 80, and now in late April reporting population around 40. Even smaller jails, Buena Vista having a population over 20 throughout the early part of the year, and then a quick decline in March, early March, and now we have a population of about 5 in Buena Vista. Now, I do want to echo that these are only 20 of the 98 county jails here in Iowa. I will note from news stories and other accounts, it does seem like many other jails are following similar patterns, but I do agree that adding more and more data to these trend lines would be extremely helpful in understanding the current state of things. Now, in the name of time, I'm just going to quickly summarize the rest of the webpage. We have a few other resources here. One is a policy timeline. Here we're documenting various policy decisions made by state agencies, including the Department of Corrections and Iowa Supreme Court. We've also listed out as much news as possible related to Iowa's correctional facilities and COVID-19, including some new articles from the Gazette. And finally, important to this panel, we've listed some additional resources. These include COVID-19 action plans from government agencies, recommendations from national groups, and some additional data collection efforts that are more focused on state-by-state comparisons. For example, this COVID prison data website has worked towards collecting the data on testing and test results for COVID-19 across state facilities. So with that, I will turn it over to our next panelist. I do want to note this is a continuing work in progress. So if there are any updates or recommendations on how we can improve the site, please email me, ethan-rodgers@uiowa.edu. And thank you.
Thank you so much, Ethan. I'll go ahead and take back over with the screen and share the screen with you all, and then welcome our next presenter, who is our final speaker today. After this, we'll move into a moderated discussion among our panelists. Daniel Zeno joins us today from the ACLU of Iowa. Daniel, welcome, and thanks very much for being here. Can you tell us a little bit about the work that ACLU is doing?
Yes, thanks for having me, Sarah. So I'm Daniel, Policy and Advocacy Director at the ACLU of Iowa. We have been, prior to COVID-19 and as COVID-19 has highlighted, particularly concerned about criminal justice reform. And so we have done a whole range of work. The primary thing I'll talk about is a letter that we sent along with 25 other organizations, including the Harm Reduction Coalition, to state leaders, including the governor's office, the Department of Corrections, county attorneys, and others, to urge them to take steps to protect vulnerable Iowans who are in prisons and jails, while also respecting constitutional rights. As many of the other speakers have noted, prior to COVID-19, Iowa already had a challenge with overcrowded prisons. While it is true that the numbers are going down, Iowa prisons as of today are still 17% over capacity. And so that's the overall number for the state prisons. Specific facilities, if we look at Rockwell City is 91% over capacity. The capacity is 245. There are 468 people who are incarcerated there, right? And so this really is a moment for state leaders to take some action. And we've heard from a variety of leaders on the call today who have done that, right? And I think what that shows is that it's possible to think about, should we be incarcerating as many people as we incarcerate today? So the letter that we sent on March 20th, and I'll put a link to the letter in the chat box so you are able to access the letter, was sent to state leaders, and it asked them to limit the number of people who are arrested, people who are given citations. It was to county attorneys to say, consider using your discretion to reduce the number of people who are held pretrial. County jails have a part to play in this. The Board of Parole have a part to play in this. And so that's one effort that we've taken. In addition to that, and I'm not seeing, I hope everybody else can see the link to the letter. The second thing I sent was a link to a web page for anybody who would like to contact their own county attorney, their own county sheriff, the Department of Corrections, the Board of Parole. We have a web page with some suggested questions that you can ask your county attorney, your county sheriff, to make sure, like what Adam was saying, that these necessary reforms to protect people who are incarcerated are not only happening in Black Hawk County and Lynn County and Johnson County and Polk County, but are happening in all 99 counties across the state. I'll just quickly close with, very early in the panel, Michele from Inside Out talked about making sure we aren't forgetting about providing support and resources to people once they are released. So two actions that the ACLU of Iowa have taken in the last 2 days. Yesterday, we submitted an open records request to the governor and the Department of Corrections to get more information about what they're doing. What actual guidance are they giving to people? How are they figuring out who should be released? And so we are hopeful that we'll get some useful information from that open records request. And then today we sent a letter along with over 20 organizations urging the governor to continue the eviction and utility cutoff moratorium. Because we know this is not just about helping people get out of incarceration, but making sure when they are out, their family, the people they're connected with, all of us can do the things that we need to do, that public health officials are telling us we need to do to be safe and to stop and slow the spread of COVID-19. I'll stop there and happy to answer questions that people have during the comment period.
Daniel, thank you very much. We really appreciate the comments from all of our speakers. We have a few minutes left, and I'd like to shift into the moderated Q&A. If you're joining us as a listener here on the webinar, please go ahead and write your questions in the chat box. If you have questions and we don't answer them during this discussion time, we'll work with our speakers to seek answers to your questions and disseminate them after the webinar. For all speakers who've presented on the call today, feel free to unmute yourself whenever you like. The question I'd like to pose to all of you first is to reflect on what we've heard today, both from individuals who are working inside or living inside or working with the people who are living inside of Iowa's prisons, and what we've heard about the policy changes that have been implemented at the state and local level. It seems like there may be in some ways a disconnect between policy intention and policy implementation. Reflecting on some of the themes that we've heard today, what do you think are the solutions to this disparity and the solution to rectifying the gap between policy intention and implementation? How do we move forward from this point?
So this is Daniel from ACLU. I'll go. I mean, I think one of the things this requires is courage by our state leaders, by our county leaders, by our local leaders. Because what this really is asking us to do is to say, the people that we are incarcerated, should we be incarcerating them? We've been doing this a particular way for a long time. And as the doctor from Lynn County noted, the United States as a whole incarcerates more people than any other country in the world. And what this does is really, it's a moment for us to pause and say, is incarceration the response? Is it the appropriate response? Are there other things we can and should be doing? And COVID-19, there's a particular public health reason for us to be asking and answering that question. But just more broadly, should the response to the whole range of crimes that result in incarceration, should it be incarceration? And to do that, I mean, I think it really requires courage, leadership, for leaders to say, it may not be the norm, but we believe, based on the research, based on public health data, based on the whole range of work that's out there, that there's a different way to do this that is more appropriate and that would be more helpful to individuals, families, and communities.
This is Adam Sullivan. I would just add briefly, if I could, one challenge is that, we have separation of powers throughout our governments. And so we really have patchworks of different policies, federal, state, local, and then even sometimes overlapping jurisdictions there. So if there's not a plan, if there's not somebody in a central government that's empowering county governments to take certain steps, then it can't happen. So what we've seen recently with the jail population declines, as I think Sergeant Kunkel mentioned, that was his office working with the courthouse, working with other folks. And so it's going to take collaboration across levels of government to have a cohesive policy.
And I'll jump in, and thanks for saying that, Adam, because I totally agree. It's important to remember that this does take cooperation across those branches of government to make this happen. Again, during this process, when we were trying to narrow our jail population, our role was really, our jail staff could identify those in a meeting and say, hey, here's this person who's in here for theft. What about making them, let's look at their case and presenting that person as a possibility. But at the end of the day, yeah, it's the court system, it's the county attorney's office, talking about those things, working with the public defender, private attorneys, and with the Department of Corrections to all take each case, each inmate individually, and look at how can we identify ways to get this person moved out of the jail, can we get their case resolved, those things. So yeah, you're absolutely right. It takes courage by everybody, but it's going to take that kind of multidisciplinary cooperation to make that happen.
Yeah, courage and collaboration, and no doubt about that. But I would also say there are evidence-based information or practices that are proven to be far more successful in other countries. I mean, there are some models from European countries where people have been less punitive. The system has been less punitive on their own citizens, and which has translated into less rigorous or less prison terms for the people who are committing crime. I think there was a 60-minute news reel or news program that I saw. So I think if we can utilize some of those models in the United States, we can significantly decrease the population. And I think, in the name of justice, we are doing injustice to our own citizens who shouldn't be in the criminal justice system, who should be productive member of this society, and how we have really targeted some of our own folks. I mean, they are overrepresented in our criminal justice system. And, I think it's the colleague who said about courage. I mean, that is the key message in this dialogue. And then from courage, we can do collaboration. I mean, if somebody, but, I also feel very strongly that we do not, sometimes I feel the system does not care for our most vulnerable population. Otherwise, we would be doing something concrete. We would be looking at some other models and making some, concrete improvement in our system. So it's a doable, but I think courage and collaboration are needed.
I do think, I'd just like to echo some of the things that have already been said. I think that they're very insightful. And I think part of this involves a little bit of a bigger culture change in terms of what role we want to have our jails and prisons play in our society, and what, you know, as Dr. DeVetti said, what the appropriate response is for some of the things that we currently incarcerate people for. You know, should we be focusing more on rehabilitation instead of more punitive measures, and, you know, what would that look like? And I think that's a larger sort of cultural, political conversation that we need to have. And I'd really like to congratulate IHRC and other organizations that are kind of pushing this more into the mainstream, and you know, making it something that people need to pay attention to and think about.
One question that I'd like to pose to the group, while recognizing and being mindful for the time of our participants and our speakers, I also do want to acknowledge the uniqueness of this opportunity to facilitate conversation between this group of experts, and the fortune we have today to hear from everyone who's speaking on the call. So we may run 3 to 5 minutes beyond the half of the hour. My question to the group is thinking about the future and what the next year to several years hold for us as we move beyond the immediacy of the COVID-19 outbreak. We've seen sweeping changes within healthcare policy and criminal justice policy to prevent COVID transmission. How likely is it to see these policies continued, especially thinking about the policies implemented related to decarceration of prisons and jails? What will this experience tell us about the general safety of the public when our jails and prisons are smaller? And what will it tell us about the health of our societies when those institutions are large versus small? And how might this inform further action and transformation of our communities?
I would just say that Adam Sullivan here, it's a fascinating opportunity to study what happened. So I mean, it's one of the biggest, shrinking of jail populations in modern history in a short span of time. And so it's going to fall on folks like the other experts here and scholars to figure out what's happening in our communities. I think there's going to be a fear we need to address that if you let these folks out, that they just go back and do crimes. And I suspect that doesn't happen, but it'll be interesting to see.
So, and I'll add to that, one of the concerns that came up when this all started, when we really started talking about isolation and people staying home, was across law enforcement, was this concern about what's this going to look like for domestic violence. And I think there were those predictions that we were going to see an increase. And what we've seen so far, judging from jail booking data compared to the same 2 months from last year compared to now, it's really flat. The numbers are about the same. If you're talking new intakes for domestic assault charges, in the same 2-month period last year, we had 51 people come in for new charges of crimes of domestic violence. This year, we're at 53. So that's hard to even make a speculation about why the numbers are flat when it goes against a lot of those predictions. What we've also seen drop off are reports of like child sex abuse, because those normal reporting routes that we got for those reports that would come from schools to DHS to law enforcement have pretty much stopped because kids aren't in school. So I don't know what we're going to see number-wise until we're 6 months, a year down the road and look back at what changed in crime for crimes that occurred now. And I think you need to look at crimes against persons versus theft, drug possession, and other crimes like that to really dive into who's in jail and what for and why, and then look at how are we going to deal with those things going forward.
And one thing I would just say, Sarah, that we need seriously healthcare for all.
Yeah, I was going to echo that. I was going to say that as well. I think that You know, when we look at the health of the incarcerated population and the way that that sort of plays into our overall population health metrics, we have such a huge portion of our population that's incarcerated, and they're generally in much worse health than kind of the free living population. And especially once they're decarcerated, once they're released, those transitions of care, trying to keep people on their medication, particularly things like Suboxone, is really hard, and they often fall through the cracks. So I think that hopefully if this trend continues, we can do a better job of building connections between being incarcerated and being in the free living population. And the best way to do that is to make sure that every single human being in the United States has healthcare and access to healthcare. And I think in that way, we'll see, we'll all be much better off.
This is Daniel from ACLU. So one thing I think it's shown us is some things that are possible. In 2 months, the Iowa Department of Corrections reduced their population by 400 or close to 400. It's possible. It's possible for other options to be viable. I think that's one thing it's shown us. And then related to what Sergeant Kunkel said, I think it's also highlighted some areas that we haven't been doing as much effective work on. So the instance of domestic violence or reports of sexual assault or child abuse, the criminal legal system being the only avenue. When all of a sudden the criminal legal system is not the avenue, how do we help the people who still are victims of domestic violence, still are victims of sexual assault, child? How do we do that outside of the criminal legal system? I think this moment is sort of forcing us to think about those questions more, because if we aren't getting reports from school to DHS to law enforcement, how do we help those kids? And then the final thing I want to bring up is we haven't explicitly talked about it, but before COVID-19, the racial disparities in Iowa's criminal legal system were huge. They remain huge. We see that in the disproportionate rates of Black people and Latinos testing positive for COVID-19. In other parts of the country, the disproportionate rates of death, right? And so these racial disparities that existed even before COVID-19, we're seeing them play out in COVID-19 as well, in terms of who gets it and then who dies from it based on a whole range of things.
Thank you so much.
I made one comment. This is Brian Leininger. In an area near me in Lawrence, Kansas, where the University of Kansas is, they had a tax on the ballot in order to build a new jail. Their jail was crowded and the tax was defeated. The citizens didn't vote for it, and that was a short time ago. And now the comments are, now that that same jail has reduced its population by about a half because of the virus, and everybody is saying, well, I'm really glad we didn't add that tax to build a new jail, because this shows we didn't need a new jail. We could reduce the jail population by other ways. So I think that gives some hope that some of these reforms and changes will exist going forward. Anytime some government agency wants to build a new jail, I think this is going to be a valid point that no, let's just reduce the population instead. So I just wanted to throw that in.
Any final comments from some of our other speakers that you'd like to share?
One thing I'd like to echo is that although this has been obviously a horrible situation, we are hopeful that some good can come of it. As Daniel mentioned, we've seen what else is possible as far as reducing numbers in both prisons and jails. We're hopeful that that can continue. Other alternatives can be found. And we found that we can be a whole lot more efficient than what we have been, whether that be by phone conferences, by speeding up processes, that kind of thing. I'm very hopeful that moving forward, once things are back to quote unquote normal, that some of those efficiencies will remain. So with any luck, at least some positive will eventually come out of all this.
Wonderful. On that note, I want to appreciate the time of everyone and thank you all for your patience with allowing us to continue this conversation beyond the half of the hour. We'll go ahead and close out, and I have a few final remarks to share with you. First, we'll be continuing this conversation and broadening the conversation. Over the next several months, Iowa Harm Reduction Coalition will be hosting a number of webinars in a COVID-19 related series, and we'll continue this particular conversation about criminal justice settings in October at our annual Iowa Harm Reduction Summit. We've got an important and exciting announcement about that summit that will be made on June 1st. And we're particularly excited to invite this group of speakers to return in 6 months and continue this important conversation. Beyond the session today, as I noted, we'll be sharing the slides and the webinar recording on our website. This recording will be posted immediately on the Facebook page of the Iowa Harm Reduction Coalition, and you can return to it and share it at any time. We also have some exciting projects in development that the Iowa Harm Reduction Coalition is working on to collect data from all of Iowa's 99 counties to document the steps that their county attorneys, prosecutors, sheriffs, and other leaders have taken to prevent the spread of COVID in their county criminal justice system. I can't thank you enough for joining us today, and we'll be happy to circulate further comments from all of our speakers, as well as answers to any of your questions in our written summary of this webinar, which will be forthcoming in mid-May. You can direct any follow-up questions or concerns to hello@iowaharmreductioncoalition.org, and I encourage you to visit our website with further questions or for further information. Finally, another warm thank you to each of our speakers. Your expertise and contributions to today's conversation are tremendous, and I can't thank you enough for your time and your deeply articulated and thoughtful comments and perspective on what's going on in this current moment. So thank you again for your time, and to those of you working in correctional facilities and healthcare settings, thank you for the work that you've been doing for our communities. So with that, we'll go ahead and conclude today's webinar, and thank you again to all for joining.
Thank you.